I really try to create a very safe sanctuary for my clients, so they feel comfortable in relaying any information they need to relay to me.
Okay, so when you are working on the client, can you just explain what you're doing so people have a sense of what it is that you're what you're looking for, what you're feeling, and introduce our client to everybody so we can address her instead of client. We can give her a name.
This client is actually a real person. Her name is Elise.
There you go. Hi, Elise.
Hi.
And the other thing I wanted to mention is the client is fully clothed. There is no reason to touch skin on skin. We actually work through the clothing. So we're going to start in the pelvic area, and I'm going to demonstrate a technique that I use for lower back pain. And I'm just going to sneak underneath her lower back. So my hand is on her sacrum, and my other hand is here. So what we're looking for is just for her sacrum, just to relax. We're looking to relax the tissues in the front of her pelvis that sometimes can become tight. And Elise, if you are feeling anything particular during this, you let us know. Any discomfort at all, you let us know. So what I'm starting to feel right now is just her sacrum's just starting to kind of give a little bit. Tissues are starting to relax. And this is good for lower back pain. It's good for any pelvic issues, gynecological issues, digestive. It's also something I use for people who suffer from migraines or headaches. An example would be if Elise happened to fall on her tailbone, what happens is there's trauma to that area, and it can create over time malalignment and those tissues to be tight, working up through the shoulder and through the neck, and hence create migraines or headaches. In fact, that's one of the first places I go when I have a migraine patient, is right to the tailbone. How are you doing, Liz?
Good. It's just interesting that there's not, it's not a lot of pressure.
No. We use minimal pressure. It's actually the weight of a nickel. And so what we're addressing is not only the tissues, but the cranio-sacral system, which is the membranes that attach in through the spinal cord and the cranium and sacrum. So we're really accessing the whole system. And our central nervous system is what controls every system in our body. So not only are we affecting the pain part, but we're also affecting things like digestive system.
So is it safe to say it's a subtle form of work, but it accesses the deeper aspects of the body as well?
Yes. So we don't have to use a lot of pressure, and the reason being is when we put a lot of pressure, what happens is the client resists because it hurts. So when we resist, then we fire up the central nervous system and it's overactive, and then we create the whole pain cycle again. So some things that I look for in a client is not just the release of the tissue. I might see a breath change in her. So I'm really looking at her diaphragm area and her chest. Quite often the person may be processing, so I'll see some rapid eye movement. And I may feel some heat sensation.
So there's very subtle clues that you're taking in that help you decide when to move forward or change what you're doing. And
Absolutely. So once I feel, things have released, all is quiet on the home front, I'll move up.
Okay.
So I'm going to move up towards the diaphragm area. And I'm always letting the client know where I'm going in case they're not comfortable, if they've had any kind of emotional or sexual trauma. It's very important to ask those questions and ask permission. And so this area is key in any kind of digestion. It's an area where I really listen to their breathing pattern, because a lot of us don't breathe properly and don't allow breath to get to other parts of our body. Right, Elise?
That's right. But I could feel that my breathing's already getting deeper just as I relax.
Yeah, absolutely.
I think we touched on this when we spoke in studio, but just to remind everybody, how do you instruct a incoming client as to the number of visits it'll take?
Well, each client is different because we all heal differently, and their history may be different depending upon what types of injuries or physical or emotional trauma they've suffered. Normally within a few visits, 2 to 3 visits, they should experience a change. And it's what feels, now she's changing her breath right now. Felt that. So normally they'll feel a change within a couple of visits. And quite often they may actually have things happen a day or 2 or maybe 3 days after the treatment too. So I usually call the client within 48 to 36 hours just to touch base and see how they're doing. So I'm going to move my way up to the, what we call the thoracic inlet, which is right near the clavicle bones, and in through the heart. And before working on her head and neck, this is a technique that's important to do. Okay. Really to open up blood flow in this area so we don't get back pressure in the head. And it's also a great technique because a lot of people, especially people who work at computers, they tend to be very rounded.
Sure,
and
bent
this
forward,
really
yeah.
helps to open up that.
It's funny, right when you went there, I just felt like, oh, that's what I need.
And for today's purposes, we're working kind of outside the mouth, but I also do in-mouth techniques for people who suffer from jaw pain or who've had a lot of dental work or
TMJ issues and things like that.
Yeah.
Okay.
Okay, so we're going to move up to the head. And I'm just going to move her hair. Okay. So what I'm going to do is I'm going to get right underneath her neck. And this is a wonderful technique for not only headaches and migraines, but also for neck pain. I'm going to get right underneath here. Is that comfortable for you, Elise?
That feels
Okay.
really good.
Okay. So we get right into what I call the suboccipital area, which is right behind the skull and actually about the first vertebrae of the neck. And most people love this. Now, one thing that came to mind is a question that people ask is, when wouldn't I do cranio-sacral therapy? And first of all, if the person had a recent stroke, we wouldn't want to compromise any of the vertebral arteries. Or if they were in a very recent car accident, certainly if they fractured their cervical vertebrae, we would not think about that. We're very careful with women who are in the early first trimester of pregnancy.
Again, I want to thank Martha Tassinari, cranio-sacral therapist of South Shores Healing Center, for having us in her office and showing us a bit more about what she does. Oh, and thanks to you, Elise.
Thank you, Elise.
Thank you.
Paul.
And thanks for watching another episode of Health Naturally.